Continuing with our state of addiction coverage and the opioid crisis that plagues Oklahoma, today we introduce you to a story of chronic pain and one woman's struggle with trying to fight it and the doctor who helped her through a therapy device. With us today is Susie Hurtado and Dr. Garrett Wright of Oklahoma Pain Management. Thank you both so much for being with us here today.
Thank you for having us.
Clearly a lot of ground to cover here. I want to get to the device and the therapy, but Susie, I want to start with you and just your journey with chronic pain. What did you experience?
Well, my chronic pain started around July 11th, 2011, so it's been quite a few years of chronic pain. Multiple surgeries from my neck to my back, shoulders. So I've dealt with chronic pain for a long time, and pain management with pain medicines, therapies, and things like that.
So you turned to painkillers to just try to alleviate the symptoms.
Absolutely, yeah.
Were you addicted to painkillers, or kind of what was your relationship with opioids?
Well, just to cover the pain, take care of the pain, never an addiction, mostly just a therapy for the pain to alleviate. Okay,
and did it work?
Sure, yeah, alleviates the pain. When you use it as prescribed, it's going to always take care of the pain, and I was able to do that. That's the only thing I had at the time.
Yeah, but not necessarily fix the issue.
Right.
And Dr. Wright, Susie is your patient, but she was not alone in her struggle. How many Oklahomans are dealing with chronic pain like what Susie endured?
Chronic pain is one of the biggest healthcare problems we have in the country. Nationally, it's estimated somewhere between 50 and 100 million patients have chronic pain.
Yeah.
And that equates to about 20% of the population. So it's a very widespread problem, and we don't have a lot of good treatments until recently.
Yeah.
And of the patients maybe that you treat that are dealing with chronic pain, how many or what percentage of those patients turn to opioids, and maybe in an unhealthy way? I mean, when does it become how prevalent of a problem is that you see?
Well, opioids are a very prevalent problem. We're experiencing an epidemic. We know that it's the most common prescribed drug in the country up until 2015. In 2015, for the first time in decades, we've seen painkillers as the #2 prescribed drug in the country.
And introduce us also to this therapeutic device and this procedure that Susie went through that you helped her with. It's been a game changer for her, she says. Introduce us to that procedure.
So stimulation is something that we've been doing since 1967. It's been around for a long time. And traditionally, we tried to cover the pain with a tingling sensation. It kind of tricked the brain into thinking there was tingling and not pain. But in the past 24 months, we've seen more advancements in this technology than we have in the past 40 years. And Susie is a testament to that because she's had these stimulators in the past, and now she's tried the new one, and it's a completely different experience for her with much better pain relief and much better quality of life.
And you're saying that this is ideal because there's a lack of risk for addiction or abuse afterwards? Kind of explain that or elaborate.
Well, the device works on electrical energy. It sends impulses into the spine and it turns the painful nerves off, something that pain pills just don't do. Pain pills change the brain's perception of the pain, but it really doesn't turn the signal off. These devices turn the signal off, and the vast majority of patients that use these devices are able to drastically reduce the amount of pain pills they use. And Susie actually did experience that with her journey.
And why do you think we've found ourselves in this predicament? I mean, it's not just Oklahoma, but Americans. Opioid abuse, I should say, is plaguing us. Why have we found ourselves here, doctor?
We don't know. There's a lot of studies going on to see why are we in this state. The U.S. uses 80% of the world's supply of pain pills, but we only make up 4% of the world's population. Why do we use so many pain pills? Why is painkillers the #1 class of drug prescribed in the country over the past 20 years, but the diagnosis of chronic pain is not going up? The chronic pain has been steady, but the use of pain pills has gone up and up and up. One issue is that it's all about money. The drug companies make billions of dollars. This year, the number 16th richest people in the U.S. are the makers of OxyContin. So it's a huge lobbying effort nationally. It's all about revenue and money, and so we think that has a big play in it, but we don't know all the answers yet.
Okay.